One night, Mr. Ali got back from work doing overtime to save money for his planned marriage. He was on his way to the parking lot, which is quite far from his office, when suddenly he heard sounds like someone was in pain.
Finally. Finished work! Oh my god. What is this sound? Wait, where it come from? Wait, let me find out what it is.
Mr. Ali walked slowly to the sideways and saw an injured man with blood all over his body.
Hey! Are you okay? Hey, let me bring you to the hospital.
Don't touch me. Don't.
What? Are you serious? Come on, let me help you. Come on, let's go.
Don't touch me. Don't.
Hey, sir.
Ali assisted him. The stranger warned Mr. Ali to not touch him, but his voice was low and muffled before he lost consciousness and fainted. The man's wound was directly in contact with Ali, who also has open wounds due to some minor accident during his work time. The man was then brought to a hospital to get treatment. Few months later, Ali went to the health clinic to do a premarital HIV test.
Morning, I'm Ali. I'd like to take the HIV test for premarital purposes. Here's the form.
Morning. Okay, let me check whether you have completed filling up the form or not. Okay, everything seems to be completed. Please have a seat first. Later, I will call your name in the procedure room. Mr. Ali?
After a couple of hours, the results is out.
Hi Mr. Ali, have a seat please. I'm Dr. Naidi, I'm the doctor in charge today. So, how are you feeling today?
Hi, doctor. Yeah, feeling good. But at the same time, nervous too, since waiting result, right?
I understood. But whatever the results are, please have faith and stay strong. Because every single thing that happened will turn out to be a silver lining behind it, inshallah.
Yes, I agree with you, doctor. But is there anything wrong with my results?
Yes. I'm so sorry to tell you that you are HIV positive. This is absolutely not the news that everyone wants to hear, but this is it, Mr. Ali. I'm so sorry to tell you this.
Surprisingly, the HIV test result came out positive. Ali was so shocked and devastated. Dr. Naili delivers the report calmly in a very ethical way without looking down to Ali. Mr. Ali's silent bowed down sadly. Without his conscious, crystal clear tears began to fall. At the other side, there is Nurse Natasha, who accidentally overheard the conversation between Dr. Nelly and Mr. Ali. Nurse Natasha walked in a hurry, straight to the nurse's counter.
Q, you know what? Mr. Ali, the handsome guy who came earlier for HIV test, was found to be positive. See, I told you, not all handsome guys are loyal. He must have another scandal out there. Once a cheater, always a cheater. What a shame. Huh? Q, are you even listening?
Mr. Ali wanted to keep this matter a secret, but he knew that he needed to do the right thing. He told his fiancée Munira about the result.
How dare you, like seriously, how dare you? I have been loyal to you all this time and I don't know. This is what I get. Seriously, I'm such a fool to fall in love with you all this time. Ali, all this time. I'm such a fool, seriously.
What? No. I wouldn't cheat on you. I never did bad things to you, man. No. Listen to me. I won't do that kind of thing. You know me, right? You know me. I'm not that kind of person. You know that, right? Listen to me. Listen. Think about it.
No, Ali, no. Please. Shut up. I don't want to hear anything from you anymore. Liar. You're such a liar, Ali. Please. Don't ever show your face in front of me anymore, please. From now on, you and me. Nothing. We are over, Ali. We are over. I wish I never knew you at the first place, please.
His fiancée called off the wedding upon hearing the result. Munira's family also badmouthed and accused him of doing bad things. Even worse, his family refused to talk with him. They chased out Mr. Ali from the family. Despite all the negative accusation on Mr. Ali, he still believes that he can be treated. Mr. Ali goes for HIV treatment follow-up appointment.
Okay, so today, Mr. Ali, we will need to take some blood samples to test for CD4 plus count and other parameters like liver and renal function tests. For that, Ms. Natasha will guide you.
Okay, doctor.
Nurse Natasha looks so shocked. She makes a fuss about this matter to everyone.
Why me? I don't want to do it. The patient is having HIV, okay? It is not a simple disease like diabetes or hypertension. What if I get infected from him? I don't want to risk myself.
Nurse Natasha, it's okay, I will do it for you. I will handle Mr. Ali blood drawing.
Nurse Kumala assisted Mr. Ali politely without feeling any bias. The procedure is done in a hygienic way. Safety eyewear, mask, gloves are put on before drawing the blood. After it is done, Nurse Kumala removed the gloves and washed her hands thoroughly. She then handed the result to Dr. Nelly.
Mr. Ali, the result shows that your CD4 plus T lymphocyte count is 180 microliter, which is lower than normal level. So, we need to start with the prophylaxis. I will prescribe medication for your treatment. And please make sure you come for the next appointment to check for the progress.
Okay, doctor. I promise I will take all the medications and I'll be here for every appointment. I really want to get healthy again and get my life back together. It's a mess.
Good spirit, Mr. Ali. You can overcome this. I believe in you. So, I think I need to do some assessment to plan for your further treatment. Can you tell me how you think you get this HIV infection?
Mr. Ali tells Dr. Nelly things that happened. Nurse Natasha eavesdropped the conversation. Nurse Kumala saw Nurse Natasha and caught her.
Huh? What are you doing, Nurse Natasha? You are trying to accuse Mr. Ali again?
Now I know how Mr. Ali got HIV. I've been accusing him of things that he didn't do.
As a healthcare professional, we need to treat patients evenly despite their conditions. We need to practice good ethics and keep patient privacy from the third parties. That way, we can maintain a good relationship between healthcare providers and patients. I hope you learned something from these incidents.
Yes, I feel guilty now. I'll make sure to be better and won't repeat the same mistake again. Thank you, Nurse Kimala.
After the consultant, Nurse Natasha made Mr. Ali to ask for forgiveness. Mr. Ali forgave her and went to the pharmacy to collect the medication.
Hi Mr. Ali, I am Atika, pharmacist in charge for today. So Dr. Nali has prescribed you Bactrim. Okay, this is Bactrim. Okay, you need to take this one tablet once a day only.
Sure. I'll take all the medications.
So you need to drink plenty of water and be aware of side effects. Okay, for example, nausea, vomiting, rash and fever. So do inform us if the condition becomes worse.
Alright. Thank you for all the information. Thank you.
As a conclusion, patient safety and care always come first despite the disease that they have. A throughout procedure is already provided to handle the patient with minimum possibilities of infection. Extra care important information should be given and informed to ensure that the infected patient's safety, healthcare providers or even other patients do not get injuries or infection. This extra care also would not allow any medical error to happen. As a healthcare provider, we are pledged to protect every patient's privacy and confidentiality. Breaching of the pledge may cause harm to us and to the patient as well. For that, let us all healthcare providers practice medicine with full of ethics and values. The end.